Hello, this is Dr. Gay from First Second MRI, and this is a 52-year-old female with complaints of pelvic pain, and she has some fibroids. Fibroids are very common, and often they're asymptomatic. Sometimes they can degenerate, become painful. They can even turn into cancer. And sometimes they just have a lot of mass effect because the uterus will grow large and displace other things. And in this patient, she has a very large uterus secondary to the fibroids. And in this case, we can see the front of the pelvis here, the belly button's up here, the spine is back here, the bladder is right here, and there's another little fluid collection here, which is fluid in the cervix. The cervix is right here. Normally, the uterus will sit back here and maybe about this big, a little bit bigger. In this patient, she has a big fibroid in the back here down in the low pelvis, and every one of these round dark things is a fibroid. So multiple fibroids. The uterus goes from way down here all the way up off of the field of view, off of where we can see. Above the belly button, here's L5, L4, L3, so it goes above that. I think we did another view here, a bigger field of view to see the top edge of it. And here it is, here's the top edge, so it goes from here all the way down to here, from front to back, completely fills the entire pelvis and the lower half of the abdomen. So this is an extreme case of how big the uterus can become because of these fibroids. This is a view in short axis where we can see that bottom fibroid back here. We're going to go up out of the pelvis, up. Here's the uterus, completely filling the entire pelvis. The intestines are just squished around the outside of this. Again, every one of these dark things is a uterine fibroid. As we're going up, we see the uterus here completely filling the upper pelvis. And now we're going out of the pelvis and into the abdomen. And here it is again. And now we're here up in the abdomen. You can still see this big, huge fibroid up within the abdomen with numerous fibroids. This is what we call a coronal view. You can see the right hip, left hip, and we just have another orientation here. Now you can see the top of the fibroid here, the top of the uterus rather, filled with the fibroids. And here's the contour, and you can again see all these dark balls here. These are the uterine fibroids. And that's it. Thank you very much.